Hi, welcome. My name is Susan McCabe, and the purpose of this presentation is to continue what we talked about last week about mindful attention training. I sent a link with a video to introduce the concept of mindful attention training to improve nursing student success, explaining how the training associated with mindfulness may help to improve how your brain functions and help you at the bedside as well as in your academic work. And this is our first week where we'll be introducing the topic. So the focus of this week, week one, is the neuroscience of attention. We're going to introduce mindfulness, doing our first practice, and the concept of meta-awareness. What you'll see over here is a weekly schedule that you'll receive. And in each week, we're going to focus on the different domains that attribute to the information processing system that encompasses what attention is, and different mindfulness activities that will help you in those areas, all for the purpose of improving our cognitive resilience as we prepare for a really high stress, enduring interval of academic work. What you'll see is there'll be recommendations for daily practice, and we try to do the best that we can. And usually, what we'll associate with that is a log in which each day you can kind of check off what you've done. If you attended the session this morning, you can check off that you did a 10-minute focused attention meditation, and you could write some reflections on what your thoughts are and what questions may have come to mind. There's also a list here, some references, and I'll add some links for you as well so that you can start to explore as you're ready to. Because this is going to be something that will be helpful to you in the long run, to become more prepared for your practice. What I want you to know is that this is a health education activity, but it's not intended to replace a health provider relationship. So I'm going to provide information to you that is based on the evidence that is known to our practice. But I want you to know that you're responsible for interacting with your healthcare provider to make sure that what we're doing is appropriate for your circumstances. You may notice, especially when using breath, if you have an experience with trauma, this may be uncomfortable for you. And that would be something you'd like to discuss with your healthcare provider before engaging in it. All efforts have been made to ensure accuracy of the information at the time that it's presented. Know that information changes very quickly. So in this week's session, we're going to do a short, focused activity where we're just going to have a discussion or an explanation of the science of attention, and introduce mindfulness practice and meta-awareness. The terms we're going to use are called the flashlight, the floodlight, and the juggler. So these are terms coined by Dr. Amishi Jha, whose expertise is in cognitive science and attention. And we're going to bring to mind terms that you may be familiar with: working memory, and more importantly, what we're hoping to achieve is our cognitive resilience. So that's going to be our focus for today. To do that, we're going to probably want to explore our willingness to participate in some mindful activities daily. They can be as short as 3 minutes of silence, or a little bit longer, up to 12 minutes of silence. Or you can use guided activities. I'm going to send you two video links. One is for a short, finding your flashlight activity that you can play on your phone or on your computer. The other is a little bit longer, closer to 10, 11 minutes, and that is a focused attention meditation practice, and just a phase one of it, just so you can get used to it. So that's what we're going to focus on this week. We're just going to take it one step at a time. So let's recall why we're doing this. And what we realize is that attention is very at risk in this current environment. And it's important to understand what exactly the attention system is and what our controls are about it. So what we should understand is that the brain is in charge of our attention system, and it purposefully privileges or biases the information that it lets us see to prevent overload. And in an environment where there is so much information, this can be very, very difficult. Um, what I want you to think about, it kind of matches what we try to do when we're trying to coach you, giving you just little bits of information to focus on so that you're able to see what's going on, because seeing the whole picture may just make it muddier for you. So when you think of all of these nodes of information and the connections that they make, it can be really overwhelming. And it should be noted that our attention system is very vulnerable to threats, threats to safety, threats to wellness, to stress, especially toxic stress, and changes in mood, especially poor mood. There's a link here that I'll provide to you where Dr. Amishi Jha talks a little bit more about this attention system. But I think we can work from here to better understand. So we have to make assumptions to attention. We just need to make sure we understand that the brain is designed to wander. We need to acknowledge that we can't have 100% attention all the time. That's an important assumption. We need to anticipate that things can become difficult. The term they use in the mindfulness world is called VUCA, which means it's volatile, uncertain, complex, and ambiguous. So, at any given time, if those things are rising, that could really impact our ability to understand and pay attention to what's going on. We also have to understand that poor mood, stress, and threat is a big challenge to our attention. And taking care of ourselves and moderating our threats, mood, and stress is going to be extremely important to help us maximize our meta awareness and what we know is going on around us. So, one of the things that you're going to learn today is that there are three domains of information processing that uses attention. One is the cognitive, which we're going to talk about today. In weeks 2 and 3, we'll talk about the emotional domain that is involved in information processing. And then in weeks 4 and onward, we'll bring in the social domain that is responsible for information processing. So let's move on to what we mean by the cognitive domain. And when I say cognitive domain, I'm talking about the thinking, planning, and decision making. So Dr. Jha, actually, she does a wonderful job describing three components, and this is directly taken from her book, Peak Minds. She describes the flashlight, the floodlight, and the juggler. I'm sorry. So let's describe the difference between a flashlight and a floodlight. Well, let's first think about a floodlight. If it's really dark outside and you want to leave your home to go out to your car and you're not sure what's out there and you're not 100% safe, what kind of light would you want? Would you want to just have a narrow beam so you could see one foot in front of the other? Or would you want the entire field or area where you're going to be flooded with light? Well, if you're like me, you like a floodlight. You like the light bright so that you have an awareness, so that you can notice what's going on. Alternatively, when I need to find something, say the keys out of my bag in a darkened area by my car door, I'd much rather have a flashlight that's hanging on my bag so that I can direct the light to pull out what I need. The ability to be able to switch the tasks is that juggler. So now what I'd like to show you is how we use this in the nursing program. So what we understand is that when you're new to something and you have to think and plan and start to make decisions, when you're brand new, you really don't know what to focus on. So what happens is that in your interaction with your lecturer in report, I'm sorry, not lecturer, but clinical coach, your coach is kind of trying to help you direct your thoughts, shine a flashlight on cues that you should recognize. Okay? So when they tell you to take these notes down, say they say there's 3 problems that somebody could be experiencing, and this is what it could look like. So I want you to go in and see if you notice that. They want you to bring a flashlight into the room so that you can pick up on those subtle, salient cues. Does that make sense? So this is when you need your flashlight. Now, anybody who's worked in a hospital setting knows that it can go pretty VUCA pretty quickly. Volatile, uncertain, complex, and ambiguous. So your instructor is also giving you some warning signs, kind of coaching you. So you got to have an awareness when you're walking in that door, kind of giving you a big picture look. They want you to kind of have a floodlight for safety as you step in that door, just to make sure you don't get yourself into a very bad situation. That's when you need your floodlight. Because if you have your flashlight on, well, you're just going to go straight to the patient. And you might have missed all the warning signs, like the patient in the other bed that fell to the floor, and we didn't notice it because we had our flashlight on. The issue is that to have these things in mind all at once means that you have to be able to juggle. We used to call that multitasking. And what we've learned from a cognitive scientist like Dr. Jha is that we can't multitask. We are task switching. So that means that you can have a goal in mind and attempt to accomplish what needs to accomplish, but you really have to be careful about things that can derail you. So you have to have fail-safes, and that's what your juggler tries to help you identify. So in summary, what we want to focus on in this information processing phase is we want to practice using a flashlight so that we can have a sustained train of thought whenever we're approaching anything, and be able to step back and have a floodlight for safety so that we can see the big picture of everything that's around us. And notice that we have to have our juggler to be able to switch tasks available, and be mindful that these things can derail us. So we have to be very, very careful when using them. In this piece, there is also what's called the attention continuum that Dr. Jha talks about. So what I want you to think about is that the attention continuum works on a continuum of being on the lower edge of functioning to a maximal edge of functioning in each of the domains. And today we're going to speak of the cognitive domain. So when it's compromised in the cognitive domain, basically our thoughts are not on task. We're switching tasks too frequently. We're getting bogged down in details that aren't helping us solve our problems, and we're unable to synthesize the information that we have. When it's maximized, we're following our trains of thought. We're able to strategize, plan, make decisions. We have an awareness of situations and we can prioritize. Interestingly, it kind of connects to that law that I introduced in the orientation session called the Yerkes-Dodson law, which was developed back in 1908. The Yerkes-Dodson law is an inverted U, knowing that we really don't get good performance if there's no stress at all. So here over on the low end. But as we start to have some good stress, tolerable stress, where we can see ourselves completing it, and we get to that optimal level, we really maximize our performance. But once we go beyond that and we're into the bad stress, where the stress is too high, we have too many circulating hormones, neurohormones like cortisol, norepinephrine, inflammatory cytokines. Well, that just causes a brain fog, and it puts us on the lower end of the attention continuum. So the important thing to understand is that the triggers to make these stressors happen, they're really kind of programmed into us in our limbic system. So mindfulness is a practice that helps us modulate our response to these stressors, to be less judgmental and less feeding into them, just noticing their presence and noticing when we're noticing them happening so that we can be on alert for changes which might compromise our performance. So now you should ask yourself, how does our attention interact with our working memory? So the image we have over here on the right is a pretty clogged up whiteboard. And the analogy that Dr. Jha uses is she uses working memory as an erasable whiteboard that we can fill with information that we want to be able to use at the moment. And interestingly, this is something that I use in the simulation lab all the time. And I even teach students to use a paper version of this using colorful pens to help keep them on track when they're in a clinical situation. So the thing we need to know about the whiteboard is that it can be erased. So it's about getting information there in a usable fashion, in patterns, um, so that we can retrieve it and recognize things that are really important. Okay, the term we use for that is most salient. So we're looking at the situation at hand and comparing it to things that we have on our whiteboard. Um, and that's how our attention system helps us use information that we're working with effectively. Now, be mindful as we stop using this information. The whiteboard gets erased, and it would make sense because how much information can you keep immediately available to you at all times? What's really important to understand is as you practice more and more with it, we start to get this information into our long-term memory that we can retrieve at later times. So then, what's the whole purpose of this piece? Well, I'm not really joking when I say we're going to think of our brain as a muscle. We're not going to think of our brain as something that we are given and we have to work with. We're going to think of our brain as something that we are given to work on. And the reason why we have to think that way is because of the principles of neuroplasticity and neurogenesis. So these are things that you're learning or have learned in anatomy and physiology, but now we're going to learn it in a way to bring meaning to your practice. Because what we're going to understand is that by doing these practices of mindfulness and working on improving our attention, we're going to help to lay down pathways and tracks uh, and expanding portions of our brain that are important to memory, and important to responding to stress. So there's some complexes. The amygdala hippocampus complex is a complex that's very involved in how we react to things in our environment, the amygdala, and how we make memories and how it affects our mood. And interestingly, with the intense education that we're doing right now, we are really um, we are hypertrophying our hippocampus, and we're creating new pathways for thinking that are extremely important. So, what are we going to ask you to do in this activity? We're going to ask you to begin by starting to figure out a way to introduce a focused attention meditation practice into each of your days. So, what we're offering you through this activity is a couple of different meditation practices. They are not um, relaxation therapies. In fact, you may not get relaxed at all. There's no reason to go into this in any way, shape, or form of having any feeling of anything being sexually good or, unfortunately bad. We're just going to notice what we're feeling as we start to pay attention to senses in our body in an organized pattern over minutes um, on each day. And over time, starting to see how that might change how we notice our body is responding and our brain is responding and our attention is changing. So I'm going to close this presentation right now. To just sum up, what we talked about was the cognitive domain that is involved in attention. We introduced concepts of using the analogy of the flashlight and floodlight to bring attention to things. We're going to practice paying attention to senses in our body as a way to start to train our attention. And we're going to use that as a foundation for our future practice as nurses and members of the nursing community. So I hope that helps. I look forward to working with you during these sessions. Thank you very much.